Hey there, my dear students and all the viewers who are watching this video now. Welcome back to Vital Vibes. So today we are going to see the history taking according to allopaths. Okay, this is not our typical type of homeopathic classical case taking. This is in general history taking, which allopaths or another physicians use in their day-to-day life practice. Let's see. So starting from the basic name, age, sex, address, source of history, we will try to dig out each and every point in detail. So name, why is the name important? Name, age, sex and address, these are basic identifiers that help in confirming the patient's identity and give you insight into potential age or sex related health risks. Always confirm the spelling and double check the age to correlate the symptoms. Okay, so what happens? While you ask the name of the patient, you get a clue regarding where the patient belongs to, which country, state or religion. There are some religions where there are specific diets or their cultural habits which are specific to that religion or that caste. So you can get brief idea or somewhat idea or clue regarding the patient. Age, there are some certain diseases which are common in childhood or congenital in origin. There are some diseases which are degenerative, neoplastic or vascular diseases which are common in middle-aged or elderly. In women, after certain menopausal age group, there are some problems like ischemic heart disease or other bone-related issues which are common after menopausal age group. So sex is also important while case taking, as there are many medical conditions which vary between both sexes. For example, heart diseases may present differently in men and women, or certain cancers like breast cancer which are common in women and prostate cancer which are common in male. So these are sex specific. In women, chest pain could suggest a heart issue but may also be related to gynecological conditions, whereas in men it's more likely to indicate the heart problem. For females, questions about menstrual history, pregnancy, postnatal history, gynecological issues like menopause, birth control, fibroids are important to consider for both diagnosis and treatment decision. For males, issues like erectile dysfunction, testicular concerns or prostate health need to be factored in. Okay, so next, why is address important in case taking? So while we are taking the case now, the patient address helps us in identifying potential environmental factors like exposure to pollutants or endemic diseases that could influence their health. It also provides insight to healthcare access and other support systems which can affect treatment outcomes. So to brief this now, we can take example as if the patient is living in urban region who are more prone to develop problems related to urbanization like exposure to constant stress, atmospheric pollutants, and for consequences they may develop IHD, COPD, interstitial lung diseases. Like who are living in mountains or hilly regions may develop problems like primary pulmonary hypertension, persistent patent ductus arteriosus, and many other diseases like fluorosis which are prevalent in certain pockets in Andhra Pradesh, and another endemic diseases can also be the cause. Another important aspect of case taking which we haven't discussed is religion. Why is the religion important in case taking? We all know that certain religions have their cultural rituals and practices which are carrying throughout the years, like Jews practice circumcision soon after the birth, and so development of carcinoma of penis is rare in Jews. Muslims do not consume alcohol and so are less prone to develop problems related to consumption of alcohol, for example liver diseases. Sikhs do not consume smoke and likewise they are less likely to develop problems related to smoking, for example lung cancers, etc. Certain sections of Hindus do not consume meat products who are pure vegan or vegetarians, and they consume high fiber diet and therefore they are protected from developing the CA colon, and many other examples are there. So this was the very basic part of case taking. Next important part is the history of presenting complaints. While patient is narrating you the complaints, it's your job to collect the symptoms or complaints and specify it, grade it according to your requirement. So what you have to do, you have to greet the patient preferably by his name or whatever you think it is right, and after that when you start the consultation you have to go with some general questions such as what can I do for you, how can I help you, or what is the problem. So the patient will present you with the complaints. Allow the patient to tell his complaints in his own words. Do not put leading questions in front of the patient. The current complaints and duration should be noted in a chronological order. So history of presenting illness. Allow the patient to elaborate the history from his onset to the present state. Take care so that you do not put any questions which are leading the patient or which may distort the patient's history. The patient may, however, interrupt the patient positive or negative symptoms pertaining to his current problems. So analysis of symptoms is important to consider the mode of onset of illness, acute, subacute or insidious, and progression of illness to the present state, gradually deteriorating, getting better, remaining the same, or having remission or exacerbation. Therefore, history of presenting complaints, that is HPC, is crucial aspect of case taking in clinical medicine, primarily in the context of diagnosing and managing patients' conditions. The concept has evolved over time with emphasis on obtaining a comprehensive, accurate and structured account of patients' symptoms, concerns and health related issues. Okay, so next, history of past illnesses or surgical illnesses which patient may have faced from his childhood onwards, or any kind of operations, injuries or previous illnesses like typhoid, malaria, etc. It is important to record this kind of previous illnesses and his history, because we should be cautious while accepting ready-made diagnosis from the patient like typhoid fever, malaria, unless the patient has records of mentioned illness. So we should be cautious regarding sexually transmitted diseases history while the patient is narrating us some kind of problem. History of previous single painless penile ulcer with painless masses over inguinal regions occurring 3-4 weeks after exposure to sex worker, which may be held subsequently with or without treatment, with formation of residual velvety scar over penis, indicates previous affliction by syphilis. So this is important, as syphilis in its tertiary form later in life can present with systemic manifestations like aortic aneurysm, regurgitation, etc. History of white discharge per urethra associated with dysuria 2 to 3 days after exposure to sex worker indicates gonorrhea. So this is important, as gonorrhea can later lead to gonococcal arthritis or urethral stricture. Along with this, we also must take into consideration another factors like chronic diseases, information about conditions like hypertension, diabetes, asthma, etc. Previous surgeries details like their outcomes, implant or anything, if it is removed or rather it is present, hospitalization, relevant hospital admissions, especially for any kind of serious or recurrent illnesses in past or prevailing, infectious diseases like past history of TB, HIV, hepatitis, etc., trauma or injuries, significant accident, fractures, injuries, medications, past or current use of medications, including the over-counter drugs or supplements, allergies. These are the most important factor. Known drug allergies or sensitivities to substance like food, pollen or any kind of medicines, etc. Immunization, record of vaccinations and any relevant immunization history is also important part. Mental health history, most important. Past mental health conditions such as depression, anxiety or psychosis. Any kind of antidepressants taken by the patient which he is hiding, this must be taken into consideration. Next, personal history of the patient. We must inquire patient about his family, his lifestyle, daily habits, dietary habits, about nature of his work, whether it is hard work or sedentary work, as this may help in rehabilitation of the patient about his possibility of overcrowding at home. Overcrowding aids in the spread of communicable diseases, and the sanitation in and around the house, about presence of the pets in the house, and use of alcohol, number of days in week, or also quantity consumed. When has he last taken the alcohol, how much alcohol does he drink, or whether he smokes or chews tobacco. So this is very important. So why we have to ask this? Basically, an alcoholic consumes alcohol almost every day, but he'll not tell you, and then develops withdrawal symptoms or abstaining from alcohol. Smoking, inquire about the number of cigarettes, BDs smoked per day, and duration of smoking, as this may be presented as duration of smoking in years into number of packets of cigarettes smoked per day. For example, 2 packets of cigarettes smoked per day for 20 years constitutes 40 pack years. Risk of development of bronchogenic carcinoma increases when pack of years exceeds 40. Smoking index, it is number of cigarettes or BDs smoked per year and its duration. For example, the smoking index of a person smoking 20 cigarettes or BDs per day for 20 years is 400. Smoking index greater than 300 constitutes risk for bronchogenic carcinoma. Chewing tobacco or betel nut is a habit common with people living in rural areas, and this increases the risk for developing oral cancers, oral malignancies. So this was part 1 of case taking, history taking in patients, which is explained very clearly and in simple language. I hope you all have understood. So continue to part 2 for further more insights, and stay tuned to Vital Vibes. Thank you so much for listening patiently.